always wonderful to be in your company as we continue to explore the ever perennial question of how can we, as Dominicans and friends of Dominica, advance Dominica and what role each one of us can play. So, whether you're joining us from every corner of Dominica this evening, you're joining us from the region, or you're joining us from the rest of the world, we say welcome to the program and thank you for being here. Of course, here on Roots Connections, we stand in solidarity with everyone who's on the front line for the various battles that we face in Dominica, including our push for electoral reform, our push for proper relations with the police department. And speaking of the police department, we always pray for Dominica, but I think at this point, we really need to see some action on the part of the police department in Dominica, because we've heard one too many murders coming out of Granby. So it seems like there is an epidemic in Granby where young men are killing each other. And my concern is not only for Granby, but the rest of the island, because this will spread to the rest of the island. So, what are the police authorities doing about this situation rather than just telling us about yet another death like they do with the announcements? We need to hear how the police department is addressing this crisis and what is being done to secure the safety of Dominica. So again, we continue to pray for Dominica, but we all know that we need actionable steps in regard to what is going on in Dominica. So as always, we stand in solidarity again with everyone on the front line, but we also stand in solidarity with those who realize that economic empowerment is also needed in Dominica to ensure that Dominicans are free to make independent choices, such as who will govern them. So here on Roots Connections, we focus on featuring the people, the events, the initiatives meant to advance Dominica, but we also focus on the changes that are needed to advance Dominica. And with so many people dying at the Dominica China Friendship Hospital, this will be our area of focus this evening. So I want to thank you for joining us for another episode of Roots Connections on Q95. This is episode number 54 for today, September 13th, 2023. And I am your host, Simone Mathieu. So we have another packed program for you. And today we are looking at best practices in hospital healthcare. So what are the supplies, the services that a state-of-the-art hospital should have? Because we hear every day from the government and from agents of the government that the Dominica China Friendship Hospital is a state-of-the-art hospital. But then we try to reconcile that with all the complaints and the deaths we see coming out of the Dominica China Friendship Hospital. So today we are asking the question, what changes are needed to ensure that in fact we have a state-of-the-art hospital? So today we are joined by a team of healthcare professionals with decades of experience in hospital medicine, and we thank them for taking time out of their busy schedules to be a part of this program to make a contribution. So today we have Dr. IP, we have Nurse Rosie Felix, and we have Nurse Halima Ama Thomas. So again, we have a very packed program for you. And what we are going to do this evening, this is not just going to be an opportunity to vent our concern. And yes, Facebook and our callers, I'm looking forward to your contribution on this discussion. But what we are going to do this evening, this is a critical situation. Right? This is a critical situation going on in Dominica. As a matter of fact, Nurse Rosie told me today, as well as Emo News reported, that the doctors are pretty much on a sick out today because they've had enough. They've had enough, and they are on a sick out. So I think this categorizes as a critical incident. So what we're going to do this evening is we're going to create a document. We're going to create a document of 20 critically important items which need to be addressed immediately at the hospital. 20 critical items which need to be addressed immediately at the hospital to get the situation under control so we can see less people winding up dead. And also that fear of going to the hospital, the fear that people have about going to the hospital is in turn leading to deaths of people in Dominica. Because if you're critically sick and you're so scared of going to the hospital, you will simply stay at home and die. So again, we want to thank you for joining us for another episode of Roots Connections. We are going to ask our panel to unmute their mics and introduce themselves. Dr. IP, I will start with you. So just give us, all you guys are pretty well known, but just give us a very brief introduction that includes your experience with hospital medicine.
Greetings and thank you for having me on the program. I just keep it basic. I'm an ear, nose, and throat specialist. I've been an ear, nose, and throat specialist for the last 30 years of my life. I trained in the UK and France, and I worked in Dominica since 2000. Besides that, I like to say I am a human being of African descent. Of African ascent. I didn't descend from anything. I ascended on those who went before me. Doing my duty to my ancestors and the unborn in the land of my birth, in the context of the times.
Mm-hmm. Thank you. Thank you very much, Dr. IP. And Ms. Felix, your introduction, please.
Thank you, Dr. Simone. Thank you. Good evening to the other panelists and to all the listeners of Q95. I am Rosie Felix. I been a nurse and a midwife. I did my training right here in Dominica from 1985 to 88. I did nursing. A few years later, I did a midwifery training. I have spent about 23 years working at the Princess Margaret Hospital, or China Friendship. That's what everybody calls it now. I did 1 year. I did 1 year stint in primary health care. That's out in the district. I later went on to do a master's degree in midwifery, and I did a 10-year stint at the Dominica State College in nursing and midwifery education. As long as I know myself in the health in the health field, I have been advocating for quality healthcare and good working environment for healthcare workers. I did a lot of that when I was the president of the Dominica Nurses Association on 3 occasions. And until I die, I will continue advocating for improved healthcare, improved working condition for our health care providers.
Yes, thank you very much. And last but certainly not least, Nurse Thomas, introduce yourself, please.
Well, I'm Halima. I'm a Thomas Abdullah. The official name is Abdullah. I live in the United States, New Jersey specifically. I am a neurosurgery, neuroscience nurse. I also specialize in orthopedics and general medical surgical nursing as we get all different types of patients on our units. I have been a nurse for the past 7 years. Prior to that, I did stints in education. I actually got trained in Canada, University of Alberta in education. And I do have an MBA that I don't use or I wish to use at some point in the future. So when I look at those parts of me, those facets of me, I think like it kind of got me to where I am right now in terms of looking at everything in a like 360 and how we can forge forward in developing the best practices in nursing, which is what we are about to talk about. Um, this is a very passionate topic for me because this is a worldwide situation, not just Dominica. It happens all over the world. And it is mostly sensitive in our population as Black people. And we are probably dying faster than any other demographic segments. And it's very important that we listen and we take heed and we do what is right for ourselves beyond the institutions, beyond the healthcare system that exists, because we already knew how to do it. And I would like to see us merge the two together, modern medicine and our traditional knowledge of herbal medicine. So,
Yes.
welcome everyone, and I am very happy to be here with you tonight.
Yes, and we want to thank our panel for being here. This is, again, our #1 program for featuring the people, the organizations, the projects which are working to advance Dominica. But it's also an important program where we look at what are the changes that are needed in Dominica. And so this evening, we're looking at the Dominica China Friendship Hospital. We are grateful to our audience who are joining us. We are looking forward to your contribution to the conversation via Facebook Live. I just went ahead and shared everything on Facebook, so you can join us on Facebook on Q95 FM radio and Push Past 10. And you can also join us on YouTube at Q95 FM radio. Don't forget to share the live. Let everyone know that we're here. Let everyone, especially those who have an incident to report. Because the other thing we want to do with this program is we want to document the complaints. So we see complaints all over the area. We get them via WhatsApp. We get them on Facebook, but let us take an opportunity to condense it to one location where we can take this program and send it to the hospital board and say, here is what our concerns are as Dominicans, as friends of Dominica, and what are you going to do about this situation? So this is what we will be covering this evening. So remember, for the best in daily programming, you can head on over to q95da.com, and this is where you will get all our live as well as our past programs. Our last program, our ever evolving culture, with Dominicans making headway in film and theater sectors. What are the opportunities and challenges we face? So that is currently playing on q95da.com. We remain grateful, of course, to Mr. G and the Q95 family for allowing us this platform where we can showcase those who are working for change in Dominica. And we can also talk about the important changes that are needed. Lambi, thank you for being on the console. Our engineer Sherwin and DJ Shan, we are truly grateful for the opportunity to be here with you. So again, if you're just joining us, this is Roots Connections on Q, and we are talking about best practices in hospital healthcare, what supplies and services should be available at a state-of-the-art hospital, what changes are needed to make the Dominica China Friendship Hospital into a state-of-the-art hospital. And I know that people are quick to say that we are crying down the country, but this evening we're going to take a very objective look, right? So we're going to take a very objective look. We're going to look at what traditionally we find in a state-of-the-art hospital, right? And we're going to compare it and see if those things exist in the Dominica China Friendship Hospital. And so we can draw a conclusion in terms of what changes are needed. So let us go back to our panel as they tell us what are some of the things we should expect to see in a state-of-the-art hospital. And don't forget, we are working on those 20 critical items that need immediate attention. Facebook, keep posting those comments. I see you, David Joseph, Hermelina. I see you, Eliza. I see you, Paula. I see you, Earl. So go ahead and share the live, because we have so many stories, so many incidents, and we want to be able to share this program with the hospital management board and share our concerns as one unit. So guys, let us talk about what we should expect when we talk about a state-of-the-art hospital. Anyone can feel free to jump in.
Well, I think the first thing we have to define is what is like best practices, like what is best practices in the clinical environment. And basically it's how we go about taking care of the patient, the treatments and the interventions that result in the best possible outcome for the patient. And at the core of that, we talk about respect for patients, respect for patient autonomy in making their own decisions for themselves, respect in creating a model that is shared decision making and that creates trust and professional patient relations.
Yes, thank you for that, Dr. IP.
Yeah, I'd maybe like to start with taking a look at this phrase that's being used called state of the art. I'd like to start there because most of the times that phrase is used connected to hospitals and healthcare. It's usually used not by healthcare professionals. It's usually used by somebody marketing something or politicians trying to impress us. So I think it's important that we try to get a clear understanding of what is meant by state of the art. And that would mean, to me, something that is innovative or new, cutting edge, and beyond what has been known to be the norm. And it is characterized by modern techniques and modern technology. So for me, that's what state of the art is. But talking about taking care of patients, I mean, I would prefer for us to speak more about state of the art care.
Okay.
Rather than state of the art hospital. And what that would mean for me is that you would be applying what is innovative, what is cutting edge, and what is beyond the norm to the technology, the practices, and the health professionals in a healthcare institution. So state of the art doesn't just apply to me, doesn't just apply to equipment. State of the art care requires the practices in that hospital to be state of the art. Processes. State of the art requires the health professionals to be innovative, to be cutting edge, to be beyond the norm, or to be informed, to be up to date. So if we take that, put that in context with the I don't even like to say it. To be honest, I don't like this Dominica-China friendship thing. But to the Dominica-China Friendship Hospital, then it means more than that, because the Dominica-China Friendship Hospital is now managed by a board or health authority. So that health authority must be state of the art if they're going to be able to get state-of-the-art care for the patients. So that's where, to me, it starts. Now, if that board is not state-of-the-art, I can't see how you're going to get state-of-the-art care. Let's put it simply as that. Right now, today, there is no board running the hospital. Okay? It's a legal requirement that a board runs the hospital. The board hasn't been reappointed. So right now, we can't be talking about a state-of-the-art care or state-of-the-art hospital without a board.
So you're saying the hospital management board has not been reappointed?
No, as we speak.
Interesting.
When it will be appointed, I do not know. So I just like to point that out and say that the term state of the art is really a marketing ploy, it's a marketing tool. But because it's a marketing tool, over the years, it has legal implications in something they call patent and tort law. So what that means for healthcare professionals is that if you have your board or your ministry saying that you have a state-of-the-art hospital, there's a certain expectation that comes there. So it exposes you now to a greater liability. And I think that's something that the healthcare professionals within that institution should realize, that if you're talking about state of the art, it puts an implication on you medical legally, because that's an expectation that if I come to the Dominica China Friendship Hospital, I've been here in the state of the art, I expect a minimum level of standard of care. Mm-hmm. And talking about standard of care is what Mrs. Abdullah referred to, in that in clinical practice, it's the standard of care that's important. It's the state of the art, as I say, is a marketing tool. And standard of care means that there's a professional obligations that the professionals have to meet on behalf of patients. Mm-hmm. So what that means is that if you fail to meet those expectations, there will be consequences. Or if you fail, or if you exceed those expectations, there will be benefits. So it's a sort of accountability. Mm-hmm. So for me, as a physician, I think that is maybe where a lot of the focus should be, from the clinical aspect of what happens to patients when they come into the institution. And maybe it would help us to move away from this marketing thing of state of the art, which really in medicine really just seem to be only applied to the machines and the CT scan and the latest this and the latest that. But from a clinical hands-on, it's really about the standard of care. And if you don't have standard of care, minimum standard of care, then you can't have no state-of-the-art care.
Yeah, absolutely.
Even before you get to state-of-the-art care, my question, or what I think the country needs to self-interrogate on, what I think the health authorities and the healthcare professionals need to interrogate on behalf of the patients, is whether we have a minimum standard of acceptable care in Dominica at the main hospital.
Absolutely, minimum standard of acceptable care. Yeah, I'm making notes. Ms. Felix, go ahead.
Yes, the quality care, if we're talking of state of the art, and really, I had that exact thought this afternoon, it should be state of the art patient care. Mm-hmm. Consumer care, that is where the emphasis should be. And as I prepared for this session, I revisited things that I had visited before, and I looked deliberately at what WHO had to say about quality care and outcomes. And it speaks about, if you're talking quality care or state of the art patient care, it should be safe, it should be effective, efficient to the institution, it should be affordable, patient-centered. Too many times we plan in all the patient care, and then we leave the patient out of the discussion, not even the patient's feedback we want to entertain, because we label it as critical and half of the story when we don't give our other half. The care should be timely, equitable, and as well as the human aspect that is very important, respectful and compassionate. Now, if we must have a standard of care, as Dr. IP has said it, it is so important to have a process where we define the standard that we want and we maintain the standard that we want. How do we get our organization to rise to that standard and to maintain that standard? Of course, as humans, we will never get it 100% perfection, but we should be able, with if we're calling ourselves state of the art, if we're offering that to healthcare consumers, which is all of us, we have a high expectation, and you can't blame us for complaining when we do not receive that high level state of the art equipment, building, and service. So the state of the art should be high in all aspects, not just the building and equipment, but the service and the standard of the service. And the patient should be at the center of it all the time.
Yes, thank you, Ms. Felix. So as we're going to dive right in and start talking about the 20 critical interventions that are needed immediately at the Dominica China Friendship Hospital. We focus already on the service, the quality of service that is required, including patient feedback. And one of the concerns I have as we talk about patient feedback is the ability of some of our patients to communicate. Because correct me if I'm wrong, but isn't a lot of the staff at the hospital from Cuba? So we have Cuban staff, and then we have Dominicans who speak no Spanish. So can we speak on that particular topic? Am I misguided when I think that there might be a miscommunication problem at the hospital?
No, you're not. The fact of the matter is that over the years, the Dominica has become dependent for its health professionals, especially within the hospital setting, on nationals from Cuba. Especially physicians and nurses, there's a process that requires what you call registration to practice. And as far back as maybe 20, how long ago was I on the medical board? It was a requirement that nationals or non-English speaking professionals who were going to be in contact with the public needed to have an interview in English to determine the extent to which it was felt they were capable of communicating in English because the basis of patient care is to be able to communicate with the patient. The first thing you do is take a history, which is you have to be able to take that history, and the patient has to be able to tell you what is going on with them, and then you question them. But over the years, that fundamental aspect of patient care, that minimum, has been undermined or overridden for considerations that I don't understand. And, there seemed to have been a dropping of that protection of the patient for whatever reason by the authorities responsible for getting patients registered, getting physicians whose mother tongue wasn't English registered. And that's tragic. And it's maybe one of the most injurious things to patients in Dominica. And not just to the patients, but even to those professionals themselves who I think are being put in a very unfortunate circumstance, because there was once upon a time you would be interviewed, and if you weren't up to scratch, from your English, not even your medical knowledge, you might have had to wait for 3 months and learn a little English and then be checked again by the medical board. I'm not aware to what extent that still happens. The evidence on the ground suggests that hardly happens and that people are being registered who should not be registered because of the lack of proficiency in English.
Yeah, so and Ms. Felix and Ms. Thomas, feel free to jump in as well, because that begs a lot of questions in my mind. That begs the question of, are translators provided, so that I'm already in so much pain, now I'm trying to explain to you in English and you only speak Spanish. And it also speaks to our ability in Dominica to recruit and retain physicians. Think of all the medical schools we have in the Caribbean. I can think of Grenada. I can think of St. Martin. I know there are quite a few medical schools in Dominica. So that speaks to our ability to recruit and retain English-speaking physicians and nurses in the Caribbean. So just feel free to chime in on your thoughts on this particular concern.
Well, one of the things that we have not touched on in terms of the model of the healthcare system, in order for any model to be state of the art, there's a business component to it. And when you offer services, there has to be some kind of way to fund it. I believe Dr. IP did an interview on that already with someone. I don't remember with who. But he basically went over how the system needs to be funded and how we should be able to offer services at a reasonable cost to the consumer, which may include us initiating things such as insurance plans, et cetera, et cetera. So the result of not having that business model functioning, that's why you have people being recruited at a cheaper cost from other countries so that those needs can be met. And healthcare worldwide we're facing a shortage with nurses and everything. So it's not unheard of that you import people from different countries. But like Dr. IP said, usually it comes with some kind of proficiency in the mother tongue of the people, or translation services are provided. So definitely we would need to consider that. It's not that they should never be able to come and work in Dominica. I think if we have a shortage and that's the only way we can fill it because our nurses are leaving, then we should, the institution itself, as part of the healthcare model, should incorporate translation services.
Mm-hmm. Yeah, so let's stay on that a little bit. Ms. Felix, let us also address the fact that we have a lot of elderly people in Dominica. We pride ourselves on 11 centenarians and, growing population of elderly people. But think about it. Many of our elderly folks prefer to communicate in Creole. So now to me, it is a double barrier, because now here you have a patient, the Spanish speaking person may have a little understanding of English, but my God, I promise you, they have zero understanding of our Creole language. So how much more of a barrier is it when we have an elderly patient going to the hospital who is fluent in English and in Creole? And it just brings back a very powerful interview I remember that Dr. IP did when he talked about one of the reasons that he went into medicine. And it stayed with me very profoundly, Dr. IP. It really touched me when you said that one of the reasons you went into medicine is you had an unfortunate experience where a foreigner was speaking in a very derogatory way to a Creole speaking elderly. I don't know if it was a relative. I don't remember that part of the story. And you thought to yourself, I will never have this person go through another experience like this. But before you chime in, Dr. IP, because I want you to tell us about that experience, Ms. Felix, go ahead with your thoughts.
Yes, language barriers certainly increases risk for wrong diagnosis, because if you've gotten the history wrong, you're going to make a wrong diagnosis. And even when you get the diagnosis right, you have increased risk for medication errors. There's a lot of complaint about increased patient mortality, and the research proves that in medication error, even by people who speak the same language, is high, far less
Mhm.
when you do not speak the same language. It's my understanding that the Spanish speaking professionals, and in particular the nurses, they look at something, they go Google it for the response, for to convert, to translate. They hear something, they go to Google it, or they ask somebody before they document. And I've heard some patient stories too, where we've had some um, issues. Not all of them come to me, but I know there are many, because we now have Spanish speaking professionals, across the board. And yes, while some of them come through special arrangements through with government to government, they should meet the criteria of um, being proficient in the language, because that would increase your ability to be efficient and competent.
Mhm.
Also, the international rights for patients speaks to providing a translator if your care is being provided by someone who is not speaking your language.
Yeah, because let's face it, when our Dominican students go to Cuba, the first thing they have to learn is Spanish because their education is in Spanish. So why isn't there reciprocity where the Spanish-speaking professionals, and again, we welcome them to our shores, but they are given English as a second language so that we can improve communication. Dr. Pascal, your thoughts?
Yeah, I'd just like to add to that the the ability to exchange your symptoms, or to share your symptoms and your complaints in with someone who understands you, it's also fundamental to your your care, your confidence that you're going to get better. So that is undermined from the outset. So because patients get better if they have confidence, and if they have confidence in first in their provider, and they have confidence in the service, you get better quicker if you have confidence in who's taking care of you, or what treatment you're getting. So that's fundamental. So if from the outset your first contact with the service, it's something that already puts up your back, that already undermines your confidence, and so immediately that has implications for your morbidity and your mortality. It has implications for costing. When you should be out of the hospital in 3 days, you end up staying 5 days because you started off on the wrong foot, and all these types of things. So it's crucial, and I think it is something that the people who manage the system need to be taken seriously. And because again, if you're going talking about state of the art means your professionals must be state of the art. So they must be able to talk 2 or 3 languages. They might have to be able to talk Chinese just now, and all that type of thing. So I think it's very crucial, and for me, it's particularly important because that's how I ended up going to do. That's the story Simone is talking about. I ended up going to specialize in ENT. It was a similar situation where an elderly lady was in the clinic with the ENT specialist, and I was in the clinic at the time, and none of them couldn't communicate. And well, I'm from Marigot, and I couldn't help out in the Creole either. And it was really embarrassing to everyone that he shouted at her, and I just decided from that day on, as long as I was alive, that wasn't going to happen in Dominica for ENT services again. So that's how I actually went, and I had to spend almost 9 months, 6 to 9 months, coming up to scratch in France in French to be able to even start to specialize. So I'm saying it is really disturbing to me when you get all these stories about patients who cannot understand and patients complaining. They ask them, what did they tell you? And stuff like that. And then you know that once upon a time that it was never like that. So that means the standards have dropped. The standard of care has dropped. So you can't convince me it's what state of the art care. It's because this just the minimum standard of communication isn't there. So I think that's a priority, or that should be a priority for the authorities at the hospital.
Yes, thank you for that. Let me come to you, Nurse Thomas, as we start talking about the important role, of course, of staffing. So we hear about the nurses, the very limited contracts. Well, let us talk about the implications for morale. Well, let us talk about how resources, our human resources, are being stretched thin, because now we're seeing that not only the same staff going to provide services at the Dominica China Friendship Hospital, but now we're hearing implications that that same staff may be required to provide services at the Marigot Hospital, because there's been a lot of pressure on the government over the fact that the Marigot Hospital has been constructed the last 2 years and it's never been open. So let us talk about the implications of staffing as we look at those 20 critical interventions, the things that we need to address immediately at the hospital. So what are your views on staffing?
So staffing also is also a very critical component, perhaps in the top three, I
Yes.
would say. During COVID, we had situations where nurses had up to 8 patients, and we were thinking that was crazy. And I'm hearing that there are nurses that may have 15 patients now at the hospital or more. I'm not sure, that's hearsay. But I find that very scary that one nurse would be taking care of that many people. I know from a nursing point of view that even 6 patients, which is our cap here in New Jersey, it's a lot. I find that my best practices are done when I have a 1 to 4. When I have 4 patients for the day, I feel like I can do everything for them. I can do all their vitals, I can take care of them, I can listen to their story, I can get more information from them that may be critical to their case. And it also reduces medication errors. We just spoke about medication errors. 96,000 people in the US die of medication errors, and that's from English speaking to English speaking. So, can you imagine we're in a system and we're having the barrier to communication? That's one factor leading to medication and errors and wrong diagnosis. Now we have staffing, and I'm telling you, there's no way a nurse can function properly with more than 6 patients. 6 is like a cap. 6 is like you're breaking my neck. I feel like 4 to 5 I can handle. 5 on a critical day. So I feel like what's happening in Dominica is because the nurses are not being paid or compensated for their expertise. They have no other way of supporting their family than to leave. And you cannot tell me in the 20th century, with all that is available to us, we boast of how much we've gotten from the Citizen by Investment program, that we cannot raise the salary for nurses, doctors, teachers, etc. I think like these people definitely need to be compensated more, or else we're going to lose them. We're going to lose the expertise, which is going to break down in the communication barriers, and it's going to filter out to every other facet of the healthcare model. So to me, critical staffing is very, very, very important, and it's something that the authorities need to take a closer look at. Like I said, I'm not against other people coming into our system, but we do need to. It's very simple. I mean, I have people that cannot speak the language when I have them as a patient. And we just pull up an iPad and we log into a Spanish speaker, or we even have Haitian Creole. We have all kinds of languages, and that's what we do. And so to me, those services can be bought. So that's a fix right there. Staffing, that can be fixed. We need to pay our nurses more. I was baffled that what I make in 1 month as a nurse here in the US, not even a month, what I make in probably 2 weeks is the salary of a nurse for an entire year in Dominica. So that's a major gap.
Absolutely. And Nurse Felix, as I come to you, and I think that speaks to some of the issues we see with customer service at the hospital. Because while we might say, well, that is not an excuse, they should still be professional. When you have nurses who are overwhelmed, and they are human beings, right? When we're listening to the ratios that Nurse Thomas is telling us about versus what we're seeing in Dominica, it provides the space where people are going to be frustrated and fortunately not able to provide the best in customer service. So what are your thoughts on that? Staffing and the extent to which the nurses are stretched, the fact that the contracts are very limited, and also the implications for morale in the hospital in general.
Yes, Dr. Matthew, the nurse patient ratio has been a sub point for, I would say, over 2 decades. Because when I came into nursing, and I'm talking in the 80s, we're talking about a ratio of one nurse to, and you said it correctly, in fact, one nurse to 10 patients, one to 10. And the nurse manager is also assigned to a number of patients. And it is not for lack of bringing the issue to the attention of the authorities. It is also not as a result of lack of nurses being trained on Dominica, because right now we have two institutions, training nurses, and creating the environment for your nurses and your midwives to stay. So even in our maternity section, where you have, if a woman is laboring, she should have one midwife to that one woman. And especially if this person is being induced, where the monitoring is more strict than if the person is going through, is having a natural labor, and they moving about. And so that is where the problem is. And the attitude is heartbreaking, because we hear comments like, well, let them go if they want. We hit the nail on the head. The compensation is just not, it's not comparable in the region, and where our nurses and midwives migrate to. And no wonder we have a new crisis. We have a hospital in Maribor, which is something we have been, advocating for, and the need. And you don't have sufficient health professionals to place. And so we're just in that crisis. So yes, the of nurse shortage on your patient care outcome. Yes, more medication errors, an area that has been really a very sore point as well, not just for the healthcare professionals, but the the people, the families. When people come to hospital, and especially on the medical wards, especially the elderly, the seniors who are ambulant at home or even bedridden at home, come to hospital, get admitted, they have no and they go high from those bed sores.
Mm-hmm. Mm-hmm. Yes, let me
You
go over to
understand?
Dr.
So
IP.
it's just
Mm-hmm.
heartbreaking. And even if about technology, at this point in the 80s, when I started my nursing career, we lifted and turned patients manually. 30 years later, the nurses are still doing that. And they are stretched and burnt out. And I agree, I can tap myself on the back that I'm a very respectful and compassionate nurse. But it takes a lot for the ordinary person to be burnt out, overwhelmed, and for them not to shut down.
Mm-hmm.
If you don't have it, you can't give it. And that is taking a serious toll on our nurses and our health workers. I remember shortly before or after Hurricane Maria, I don't remember now. I was the president of the Nurses Association, and we're carrying out a survey, to find out if you had to change your mind, or rather, what would cause you to change your mind? If you were planning to migrate, what would cause you to change your mind? And what many of the nurses were saying? That the environment had become so toxic. So people are no longer running away only for better compensation, but the culture, the environment have become so toxic. People, for their mental health, for their sanity, people are running. So the combination of factors have skyrocketed, and the authorities have to do a lot and come real strong, to just to turn around, to make a big shift, and for us to change the outcome. Because unless the the people receiving the services and experience
Yeah, so Nurse Felix, I think
engaging the service,
we're
unless they
having
can shout to boast. And of course, there are a few people who boast, about their experience, and because they're honest. But it shouldn't be the exception; it should be the general rule.
Yes, and I think we're having a little bit of connection issues with you, so I'm not sure if you can take a look and see if there's another option for your internet connection. But we got everything that you were saying, but it's freezing a little bit. So if you can take a look at that, Dr. IP, I think you wanted to share.
Yeah, I just like to reinforce what Nurse Felix says, because it's essentially in 2023, the major contributor, or the biggest contributor to ensuring you get quality health care, is finance. And it's as simple as that. Nurse Abdullah mentioned it, MB and all of that. But in truth and in fact, that's the major. Before, it used to be maybe the health professionals, the doctor, sometimes the level of education of the patient and all these things, those weighed in. But in 2023, or for the last 10, 15 years, with the rise in technology, because the rise in technology has increased the expectations of patients, and the rise in technology is costly. It's finance driven. You have to have money to get the technology. And the doctors and the nurses need that technology to provide quality care, because they were trained to use the technology. They weren't trained in the days where you would, have to guess and all these things. So, and I think that has been the major problem for the healthcare system in Dominica, the failure of central government to increase the funding over the years to the healthcare system. I can't say what it is, but I am quite sure that it hasn't changed in the last 10 years, or even has changed nothing significant. And some of the stories you hear, especially from even the board itself, that's given this hospital to manage without an increase in finance and an increase in everything else, increase in administration, in a number of people in the administration of the hospital, the number of specialists, there is no way you're going to get quality health care without an increase in the funding. And and then if you don't get that increase in the funding, and instead of finding the funding, the government chooses to take the easy way out and get people, instead of paying locals and increasing the salaries of doctors and nurses and other locals, you figure, well, it's cheaper to import other professionals. But if you drop the ball on making sure that they're up to scratch and they can communicate with the people, then we're suffering twice. So I think one of the most urgent things, and I will reinforce that, is that there needs to be an immediate increase in the amount of money made available for quality healthcare in Dominica. There's no way you can get any quality healthcare or any better quality healthcare until the government addresses that. And I think it's tragic that we can hear about all these monies being spent for all these different things. I don't care, even Creole Festival and all of that. And you can't hear more monies being made available to run the hospital.
Can I say something about that?
Yes.
While
Yes.
I understand all of that, I do believe the onus is also on us. I understand the point you're making, Dr. IP, but however, we ourselves have been lax in our health care of our own personal health. And there is no way, I don't care how many billions of dollars our economy stirs, it is almost like, given the number of people on island and given the different parts of the economic model to sustain healthcare, it is a burden on the government. And objectively speaking, there has to be some kind of fee for service instituted. The hospital cannot be fully funded. We, the patients, we, the community, have to take responsibility. We find the money to go to Guadeloupe, to go to St. Martin, wherever we go, to get the health care that we need when we have emergent situations. How about we come together as a community and find ways to develop foundation, committees to make people accountable for their actions, and to find a different way of doing things. I'm all about actions. I understand the dialogue with the government, but that's not working. And we don't know if it's going to change. We don't know if we wake up tomorrow, government is going to decide to give us more money for funding. So the reason I'm here is, what are the solutions? And to me, that's one of the solutions. We need to start paying for the service that we're receiving, because we find the money for everything else. We when I'm in Dominica,
Yeah, I'm coming to you, Dr. IP. I see you.
Sorry to digress, but when I'm in Dominica, there's a long line at KFC. So if you go into the hospital, there needs to be some kind of way we can charge you a basic fee that goes into helping with supplies, okay? Or the government needs to institute a national insurance program whereby people can pay into it monthly. And of course, there'll be people that can't afford. There'll be a different type of program to help them. But we gotta be realistic that the way we want healthcare to operate, our lifestyles crippling us and then expecting someone to pay for it, we have to be up. We should be truthful of the fact that it's not possible to do, because here in the US, I can pay up to $600 of my salary for insurance. Okay. So it's only if I'm in a low income category that I'm not paying for healthcare. So the reason we see the wheels churning in big nations is because we have foundations, they have annual drives, they have that's basic stuff we could do to have an annual drive by the government themselves, reaching out to people. How can you help us fund this institution? We're having a drive, or we would like to institute a national insurance program. And then also the health promotion part of it. How are we going to get these people to take care of themselves and stay at their home so they're not coming in with, oh, I have hypertension because I'm not eating properly, or I'm engaging in reckless behavior, not knowing how it can affect me.
Yes, yes. And we're going to look more at solutions once we've come back from the break in terms of having our callers come in. But Dr. IP, let me hear your thoughts.
Yeah, that's perfectly correct. And actually, that was that's in part of one of my recommendations. Where do we go from here? Because at the end of the day, I agree with Ms. Abdullah that your health is your responsibility and your health is your wealth. So fundamentally, that is the sort of consciousness that need to be brought to the citizen in Dominica. Now, but who does that? And if we go back to it, what health is, it's about mental, psychological, social, spiritual, and prevention. Now, as much as I endorse the fact that self-reliance and responsibility approach, simultaneously, there is an approach, and you have to remember, put in the mix where our people are in terms of taking responsibility for themselves. So if you're being cocooned and protected for reasons that you don't understand, and you think it's helping you, but it's really setting you up, because if you take the example for example, that we have a policy that says if you are, I think, under 18 and above 60, you don't pay. That's ridiculous. How does that encourage me to take a preventative approach? Because if I don't have much money, all I will do is pray and hope that I don't get sick before I get to 60, because even if I can afford to pay at 60, it's free. So if you don't have policies that encourage that self-help, that protect it, if you don't have policies that makes it so expensive to buy KFC or so cheap to get local food, then that burden is a burden that shouldn't be borne by the individual Dominican. So that's why I say it's both of them. It's not one or the other. And I think because I mean, let's be honest. This government has promised to have a national health insurance for the last 20 years. You have people like me who have health insurance that can afford to pay, but I'm 60, and I just said what my age is, and I'm 60 and above. If I can afford to pay, if I go to the hospital tomorrow, I don't pay. Where does that policy come from? That's a government policy that is, to my mind, and I'll say it upfront, is all about getting votes than addressing healthcare issues. Because when you do that, we had a pretty good primary healthcare system that was focused on prevention. Okay? If I am struggling to get along, how am I going to concentrate on prevention if I know that if I fall sick above 60, I don't have to pay for it? What's going to encourage me to get up every day, go and exercise, eat good food, don't eat cheap food? It's a policy that encourages me to get sick. Mm-hmm. Because it is not based on ensuring that I stay well And when I get sick, there is enough money there to take care of me. So the failure to provide the resources, even for the promotion of healthcare, even for the prevention, I don't think it can be minimized and overlooked, especially when there has been no significant increase, because the ordinary citizen, to me, has an expectation as well that the people they put in charge to take care of them are doing those basic things to take care of them.
Mm-hmm.
So I think it is, as much as I am all for that, because I even think that people right now, because of the state of care, should start making sure they don't end up at the hospital by trying their best to take care of themselves, don't drive fast, don't get into accidents and all these things. I mean, these are the things that people can do immediately to help themselves, and even start to put money aside, try to get insurances, put some money aside every month from their salary, so that, God forbid anything happens to them, they can at least go to see a private doctor or pay for whatever services they may need, which is not available at the public hospital. Mm-hmm. But that doesn't mean that the responsibility of central government, because it's a double whammy in a way, because if you have no confidence in the accepted healthcare institution or the major healthcare institution that's supposed to, that you have been socialized, that's where you go for treatment to get well. What happens is that you delay, as was mentioned earlier, going there. And by the time you go there, you are too sick to be taken care of. So what happens to you? You get sick or you die. Mm-hmm. So I don't think that is something that should be taken lightly or that should be misunderstood. And I think it is, that's why I think one of the immediate things I don't think the authorities should be let off the hook on this one, because it's been going on for too long and it hasn't been.
I don't think they should be let off the hook.
Yes, just give me 1 second, guys, because I'm really I'm happy that you're very passionate about this conversation, because again, it's very critical. But we must take a quick break to invite our callers. But when we come back, because I know that you guys have a lot of recommendations to offer, so I want to just open the floor when we come back, so we can start talking about recommendations. We can start talking about solutions. And again, as we go to the studio for the phone calls, I sent you guys the link to the Facebook Live. So if you want to invite everyone to join you, and guys, on Facebook, we have over 90 people, 90 on Facebook. We are very happy that you're joining us to make a contribution, but please forgive me, I will not be able to take all your comments. But I think it is great that you're posting the comments, because remember, what we are doing here this evening on Roots Connections on Q is we are creating a document. We are creating a document of 20 critical interventions. What is needed immediately as interventions at the Dominica China Friendship Hospital, because we have to intervene and ensure that people feel safe to go to the hospital, because we're hearing there's a lot of fear of folks not wanting to go to the hospital. And we also have to make sure that when people are at the hospital, that their likelihood of coming out of the hospital healthy and not in a body bag, let's be honest, increases. So that is exactly what we are talking about, 20 critical interventions that are needed immediately at the Dominica China Friendship Hospital. So panel, we have Nurse Halima Ahmed Thomas Abdullah, we have Nurse Rosie Felix, and we have Dr. IP with us. So guys, get your recommendations ready. As soon as we come back from the break, we're just going to open the floor and we're going to speak to the recommendations that you have compiled for us this evening. So Lambi, over to you in the studio.
You're listening and viewing Roots Connection in Q. We are taking your calls right now. The numbers are as follow: 449-3095, 449-3096, 449-3097, 616-4257. These are the local numbers. The overseas number, 305-432-9624. Let me run those one more time. 449-3095, 449-3096, 449-3097, 616-4257, or local numbers, and the overseas number 305-432-9624. And we already have a caller, so stand by for that call. Good evening, caller. Thank you very much for being there. Go ahead, please.
Good evening, gentlemen. A good program.
Thank you.
I live in New York City, and I've been following a lot of health issues and policies by now New York City mayor and his administration. I recall some time ago, the mayor was having a community affairs meeting and he was explaining his health conditions. And he, in essence, was saying to his listening public, his community, that he had all sorts of illnesses. He was diabetic, and you just name it, high blood pressure. And he changed his diet to more or less plant-based. This is a policy that instituted in most of the public hospitals in New York City that I currently work with the corporation. I was wondering if the same could apply to Dominica to lessen the effect of all these, ailments that you're hearing, young people, middle-aged people, and old people dying of diabetes, high blood pressure, and all this stuff. I was wondering whether the changing their diet at the hospital, and even maybe on a campaign to encourage people to do the same. Right now, 80% of my meals are made out of plant-based, and I feel so good. I'm 65 years old, and I am doing the treadmill every day. I'm doing the elliptical machine. I'm doing the sauna. I'm doing the steam room, and I feel great. So I think a campaign like that could possibly lessen the effect of all the ailments that most of our young people and middle-aged people are going through. Dr. IP, I would really like your commendation on this one. Thank you very much. Great program.
Yes, thank you. And that speaks very well to the importance of public health. So someone make a note that we need to talk. I know, Amma, you're very passionate about that.
Health promotion.
Health promotion, yes. Health promotion. Let me make a note of that. Health promotion. Yeah, so let us go on and jump on the Facebook Live and see who we have here with us. Peony Shirley, I'm listening and watching from St. Thomas. My mom, Medina Senhouse, always great to see you. Teresa Susanna Roll, Indigenous Bushman, I see you. Dr. Margaret Wallace, I see you. Thank you for being here. Let's see some comments. David Joseph, greetings and good night to each and everyone in the audience. Special good night to the panelists and the host. Lambi, good night to you. My friend Paula Lupin is here. Earl, Winnie, Margaret Wallace, we said. Alvin says good night to your guests. Good, important conversation. So we're going to just try to take very few comments from each person. David Bertrand out there in the UK, good morning. Well, David, it's morning for you. Thank you for being up with us. He says good morning, Dr. Simone, Dr. IP, Rosie, Halima, Lambi, and the listening public. From YouTube, Anu Imas Records, good night, everyone. Thank you for that YouTube comment. Yinwa Berige, good night, Dr. Pascal. Sandra Guerin says, I recall many years ago when my aunt was in the ICU department and the Dominican nurses used a determine the definition of a word and put it in the context of the conversation. This, I can tell you, bothered me a whole lot. Thank you for sharing that. Nixie Alfred, learning of the English language should be mandatory prerequisite before the foreign healthcare workers are allowed to work in the healthcare system. Sam Kelly, very interesting dialogue, but I think a person from the Ministry of Health should be on the panel to deal some of the concerns and speculations right on the spot. A lot of things could be clarified immediately rather than waiting for a delayed response or sometimes none at all. And Sam, you're absolutely correct. But the question is, can we convince anyone from the ministry to join us on this program? And the answer is unfortunately not, because we have tried reaching out at different points in time to different government officials to be on this program, and unfortunately we don't even get a response, no acknowledgement of receipt of your email or anything. But again, we are always open to inviting everyone and anyone who has a contribution to make to this program. Mervyn Wallace: any foreign medical graduate seeking a practice in the US must take and pass an English test before getting a chance to apply to a residency program. It should absolutely be required that imported professionals into Dominica should be proficient in English. Winnie Green: one important factor is ongoing training for all professional and administrative staff. Most importantly, how to administer good customer service. Cecilia Joseph Cook: I see you. What's the starting pay for RNs? We lost Rosie for a minute. Hopefully she'll join us in a little while. And Nick S. Gray: hey, nice to see you, Nicole. Nice to have you here. What are the nurses' pay rates? So let's make a note of that. What are the nurses' pay rate? We have a phone call coming in. Let's take the call.
Good evening, caller. Please go ahead with your call.
Good evening, good evening, panelists.
Good evening, sir.
I agree with you. I agree with you 120%. Politicians need to stay away from the hospital. Okay. I guarantee you, if election were to call tomorrow or next week or this month, the amount of goodies you would hear going in the hospital for the citizens of Dominica, you would be surprised. Kerry promised those people free health care for the election. In one election cycle, Kerry spent $129 million. Today, he has nurses and doctors staying away from the hospital. We cannot see any benefits Kerry put in the hospital over the last 23 years. So I am telling you, politics is the one that brings health care to its needs in Dominica and not the Dominican people. Imagine a prime minister tell you, two people coming for a job to him. One is a labor right and one is a UWP or a freedom right. He will choose a labor right no matter the qualification over the UWP or anybody else. And what I'm saying is that what's going to provide health care is everybody working. If you're discriminating some people against another and everybody has to use the hospital, how can you raise enough money to develop a proper health care when you're discriminating half of the people in the country or even 3/4 because they're not supporting you? God bless Dominica. Thank you.
Yes, thank you, caller. Thank you. And don't forget, he also said he has health insurance and can fly out of the country if he and his family gets sick. How about you? And then what happened? All the people in the audience, they clapped. So let's leave that alone. David Joseph: we are lacking specialized doctors in Dominica. Too often we have only one doctor specializes in certain fields. At present, we have mute your mics, please, Rosie, mute your mic. At present, we have only one cardiologist on island. If we are to send doctors overseas for training, we ought to know the areas where we are lacking and have individuals trained in those skills. Yeah, when you get a chance, let's mute your mic. Let's see. Mervyn totally agrees. Marlo Mandingo: objection. Yes, we can pay sometimes, but government have money to do all kind of magie. Stoop stand. Okay, very colloquial. Alvin: health and lifestyle goes hand in hand. The high rise of cancer and other illnesses has to do with many of these young persons' lifestyle. Monel Williams: John Baptist, great to have you on board. On a point of correction, healthcare in Dominica is not free. It's only free for children from 0 to 16 and 60 and over. Additionally, oftentimes when healthcare is sought off the island, it is usually funded by a GoFundMe or something about government who has not diverted enough resources into the healthcare sector. We cannot allow the government to abdicate its duty by ensuring that the health sector is properly funded and our health workers duly compensated. Thank you, Monel, for that. Hermelina Watson Duvini, hi, Auntie Hummy. The food they serve at the hospital is not much different than the bad food that the people eat out there. A fry balau, a piece of bread, I think you mean a piece of bread, and a cup of lukewarm tea for dinner in a hospital. Wow. Winnie Green, Nurse Abdullah, you hit the nail on the head. The buck starts with each individual understanding the importance of maintaining good health, and that encompasses diet, exercise, prevention care, mental health, and overall lifestyle adaptation. Last name Beringe. In the small BVI, there is National Healthcare Insurance. Everyone is supposed to be a part of it once you're working, and a percentage is deducted from the salary monthly, like SS or income tax. Indigenous Bushman, nice to see you. It says, great discussion. Rasbado Smith, Doc, tell them, Nixie Alfred, I agree with Dr. IP, the proper policies have to be enacted. The provision of national health insurance should also be a focal point of attention for those in authority. Indigenous Bushman preventative measures should be protected. One more from Monel, the hands-to-mouth salaries does not allow for set-asides. Doc, the economic situation of the country will help to further exacerbate health situation. Stress alone. Thank you so much for all your comments. Auntie Hami says the stress of the majority of Dominicans under how can they eat well and exercise. So guys, keep the comments coming and I will try to get to them as soon as possible. But again, for our panel, let's just open up the floor. Anything you want to comment on in terms of the comments on Facebook and our callers, and the recommendations that you would like to offer at this point. So ladies first, Dr. Nurse Amma, go ahead.
Well, I'm going to zone in on the question the man who called from New York. He talked about taking the onus, like making sure that we take the initiative for our health. And I do a lot of lives on health and they're public and anyone can see them because I feel that's how I can give back to the community. I don't have money, but I give information. So if you want to follow me, I also have Dominica Garden Club, where we have gone ahead. We have over 1,000 members now, where we have gone ahead to encourage Dominicans to grow what they eat. Listen, in all my lives, I say, we all already know what we should be doing because we were raised by people who had a good understanding of how to take care of themselves. When I was growing up, hospital was for old people that something happened or somebody that had some random issue that they could not handle, an acute situation, or for an accident, something of that nature. But hospital was not necessarily where you would find people my age group now, like Gen Xers are dying at an alarming rate. That's the population between late 40s to like early 60s. We're dying at an alarming rate from cancers and non-communicable diseases and other diseases that we can prevent. And I always say, let's just say that the government is going to do nothing. We still have to survive. We still have to take care of ourselves because I don't see the situation changing. And that's why I say the whole reason why I'm here is to talk about actions. Like, yeah, we can call and talk about what the government did or the government not doing. And I get that. And I agree to a certain extent. But let it start with us. Grow your garden. Go to church. Stop driving recklessly. Take a hold on your teenagers. Make two ends meet the best way you can be and put the money into food versus the things that we see, that we want, that we cannot afford. There's a lot of that going on at home. People, you will see them today enjoying a party, a SeaWorld, a fete, and then tomorrow they have to ask somebody for $5 to feed their children. Well, I'm going to be direct and I'm going to be point blank. And then before time, yeah, people would go and party and whatever, but everybody knew Sunday morning they went to church. How many people are engaged in mindfulness? How many people are exercising, doing something to release all the stress that they're dealing with now? Dominica is a stressful place. Go in your garden, take off your shoes, ground yourself, go to the beach, take your children to the beach, take them off the electronic devices, grow your food, eat your food. That's going to be the biggest thing I focus on here tonight, because I'm not sure anything is going to change. So all I'm going to be advocating for, that I advocated for in the past, is to take the responsibility for ourselves.
Yeah, very good. And Lambi, someone wanted the overseas number. So can we repeat the overseas number one more time?
The number is 305-432-9624.
Thank you. Yeah, so IP, hopefully that person got the number. Yeah, so the floor is open. Nurse Felix, if you wanted to add your recommendations, we're just going to open the floor and talk about our recommendations. Where do we go from here? Give her a minute to unmute her mic. Oh, you're muted again. You're muted.
It's a bit slow. Yes, thanks. I lost connection there, and it cost me a few minutes. So you're saying you were discussing recommendations. Right. So of course there are many things in place, as it pertains to services, that are offered at the hospital. There have been increased services in the last 20 years. There have a lot of services that have been added.
One second, Nurse Felix. Let's take a phone call. I'm sorry. Hold that thought, okay?
Good evening, caller. Thanks for being here. Go ahead, please.
Hello, good evening.
Good evening.
Good evening.
Hi. Interesting program going on in Dominica.
Thank you.
My name is Geoffrey Lafont. Let me be transparent. I've been listening to your program over the last hour or so with regards to healthcare and the state of art in Dominica. My question is to Dr. IP. He said if there's more money put into the health system, there will be improvement in the health system. Does he really think the doctors would perform better in the health system? The nurses would perform better? I think not necessarily so. I think the policies with regards to the health system is flawed. So hence we have a flawed health system in Dominica. The elephant in the room is medical training. I'm going to be plain about it. Cuba has an excellent health system, but the health education in Cuba has been watered down because of the numbers they have taken over the last 20, 30 years. So Cuba has so many schools that the doctors are not getting the sort of experience they need, to become proficient doctors. So that's the elephant in the room to start with. And let's not beat about the bush. I work in Barbados. Barbados do not take the doctors from Cuba. They have to do an internship again because we recognize the issues with the Cuban medical education. It is disparate from the Cuban health system. Yeah. The next thing is the changing face of health in the region. That in the past we did infectious diseases. Now we're doing this chronic, non-communicable diseases. we have to appreciate, we have to change our focus with regards to health prevention, what we eat, our lack of exercise. You know, we talk about how many more doctors we need, and when people taking all the bad chicken we importing from overseas. You know, young girls, boys attaining puberty before they reach 8 or 9. So we have a change in focus, not just money. Money, yes, will do a lot better, but we need to change the policies with regards to how we address and set up a health system in Dominica. But Dr. IP, tell me about, do you think if we put in more money in the health system in Dominica, things will improve? That's my question to Dr. IP. Thank you.
Yes, thank you, caller. Thank you, Mr. Geoffrey Lafont in Barbados.
You want me to answer that?
Yes, and then we'll come back to you, Rosie. Please keep your thoughts, okay?
Thanks, Geoffrey, for putting me on the on the spot.
The hot seat.
The answer to that is really that the issues in health in Dominica have multiple causes. Health financing is just one of them. So, like everything else, even when you're treating a patient, if there are multiple causes for the condition, you have to address all those causes for you to ensure you get a good result. So I would say that health, because of the fact that what drives quality health care in 2023, and no one will deny that, is technology, and technology is finance. I would want to believe, although there's only one way to know, you have to put in the money, that's the only one way to know. I would want to believe that it would, based on, if you take that scientific approach, if financing and the efficient uses of financial resources within the healthcare is the major factor in determining the quality of health, it stands to reason that if you increase the financing, you will get some improvement. You may not get the improvement you want without addressing the other factors, but all the other factors that are also dependent on financing. So whether it's health information, whether it's health education, whether it's vaccination, whatever preventative thing is also in the modern age determined by technology. You have to be able to go out there, you have to be able to reach the people where they are. And it's the only way you can do that is with technology. So I can't say how much it would improve it, but I figure, yes, definitely, there is no doubt about that, in addition to the other things. Because the research shows, in truth and in fact, that there are 3 major determinants to quality of healthcare in our times. One is the quality of the healthcare professional to which you spoke to, whether it's a nurse, a lab technician, a physician, the educated or informed patient, and financing or technology. And so those are the 3 major things. So you would have to address all of those things for you to get a quantum leap in your quality of care, but you would most likely get the biggest leap if you ensure that the necessary financing for the minimum standard of care and the efficient use of that resources would be critical. That's the way I would answer the question.
Yes, thank you. And Nurse Felix, let's come back to you. You were in the middle of a thought.
Yes, and I'm not sure I remember the exact thought, but I'm listening to Dr. Pascal and responding to the question. It's taken me to primary health care. And Dominica, we were on a trajectory to where we had the best primary health care in the region, which of course spoke to prevention of disease. And so where we are at now at our hospital, overwhelmed with chronic communicable non-communicable diseases added to the emerging infections that we have now have complicated matters. I believe a heavier investment in our healthcare providers, especially our nurses or physicians or midwives, would make a difference, because the truth is many of our local consultants, they come here and the pay is so mega, they leave. That's the major reason, among others, of course, while our many of our nurses are leaving. People, tell you, if I were paid well, I could take the stress, but I can't be taking the stress and still no money, to go with it. And of course, if you pay people well, you would be able to be even more strict with your rules and your regulations on them. I want to go back to the point too of the policy, as Dr. Jeffrey said. Our policies, our healthcare policies are weak, and as for who is asking to implement them, the health commission, who was tasked with the assignment to was assigned the task of evaluating our healthcare system and to come up with solutions to improve it. That health commission, or many of the people who are on the health commission are now on the hospital authority board, and loads and loads of recommendations have been given to that commission, and you have now the commission has turned to be the board, and instead we have great improvement. We're not seeing. So the people again we put into make the policies and implement the policies. We have a problem there. And as I started earlier at the beginning of the program, when I spoke about quality control and risk management, if we cannot strengthen our quality control and our risk management department, then it means we don't know what our standards, we don't know how to maintain our standards, how to intervene when we go below our standards. So we will not achieve the state of the art that we want to filter down to the client. We've been talking about national health security insurance for 20 years, and nothing has come out of it. But again, I do agree with Ms. Halima there. We have to take a lot of responsibility, and in as far as it concerns the preventive part of health, we got to rise up and be more aggressive about preserving our health, because if we are afraid to go to the hospital, we may as well fight to save and the good health that we have remaining. Those of us who have good health, those of us in perfect health, we've got to be very aggressive about maintaining that health. But again, we need to invest in our health professionals financially, as it pertains to their pay, and then have our health or quality control come down heavy, because we know paying you well and we're giving you all the resources to do your work, so you don't have excuse.
Yeah, thank you for that, Ms. Felix. And I want both you and Dr. IP, I'm coming to you, Ms. Amma, but I want both you and Dr. IP to tell us the role of the Hospital Authority Board, because we've talked about them quite a bit, but we don't seem to be hearing from them with regards to all the complaints that we hear on the grounds. We know that the Dominica Public Service Union has been reaching out to them, and they don't even acknowledge receipt of the communication. So I want you guys to think about the role of the Dominica Hospital Authority. Ms. Amma, I'm going to come to you, because we had talked about doing this at a village level in terms of supply. So I want you to speak on that. But I think we have a call. Lambert, is the caller still there?
Let's see. Caller, are you still there?
Hello.
Yes, good evening. Go ahead with your call.
Good evening. I would like to I would like to invite the committee or whoever is going to put up the whatever to whoever authority, to the authorities, your recommendations. Include in your recommendations that if there are 3 to 1 kitchen preparing meals for patients, they should have a dietitian there. I was a patient at the Princess Margaret Hospital, and I am diabetic. I never ate there because as soon as they brought the food in, I will see on the plate is written diabetes. When I uncover it, the food is not for diabetic. It's for the normal person who is healthy eating normal food. I would see beef. Oh, I never see beef in my life like that. Mostly every day is beef. I don't know which farmer is giving the hospital gifts, but at least they should inform farmers when they bring in what to bring in. And I wasn't eating the food. If it had vegetables in it, I would pick the vegetables out and eat it. But they would notice that that particular patient was not eating the food. As for the dinner, I never used to have that because they would pass around 5:30, and give you 2 slices of bread, white bread, and one little slice of whatever, if it's sausage or cheese with it. I would take the tea because the tea used to be very hot. I wasn't taking the milk. The milk was glowless. I would take the bush tea. But then they should have people informing the cooks, whoever is preparing, what to prepare for whoever. And when they are distributing their food, make sure they give the food to the person it's intended for. Thank you.
Thank you. Thank you so much, Carla, for your contribution. And Miss Am, are you with us? Yes. So we had a conversation and we talked about the importance of doing this as a village level, because what we found is that even when Dominicans are interested in sending supplies to the hospital, many times it's rejected. Right. So we talked about the importance of having emergency kits at the village level, maybe through the village council, so that when Dominicans have to go to the hospital, again, taking matters into our own hand, which is something I know that you're passionate about, at least having some supplies that they can take with them, because we already know that when they get to the hospital is going to ask them to provide supplies such as gauze. So your thoughts on that, Nazama?
Well, it's something we've spoken about. I do believe that, so for example, when we do give supplies to patients here, we're operating on a budget. We've not talked about budget and logistics and supplies in this life. From what I know from working with healthcare system, is that supplies and equipment are very expensive.
Yeah, I'm not sure. I'm not sure if you changed something, but your voice is sounding very staticky. Did you change your device?
No. Can you hear me?
Oh,
Is that better?
yeah, you're sounding very staticky. Let's try again.
Well, let me leave and enter back, and then you can keep going to something.
Okay, that's fine. So in the meantime, let's go over to Nurse Felix and Dr. IP. The role of the hospital authority board, and why, despite all the uproars we hear about the complaints in Dominica, we hear nothing from them.
I would want to think that the role of the board is to ensure its staff, and not only nurses and doctors and midwives and all the technicians and so on, but from the top level to the bottom level, because everybody who works in the hospital impacts in some way people who come to the hospital for service. And I'd want to think that the role of the board is to ensure that the quality care is delivered. And by quality, I want to reiterate care that is safe, effective, efficient, affordable, timely, equitable, respectful and compassionate, and very importantly, patient-centered.
Absolutely, Dr. IP. And this Amma, we're coming back to you.
It cannot, sorry, Dr. IP, it cannot be only about contract and uniform and who stays, who goes. The main thing is the delivery of care, and that is where the emphasis is supposed to be.
Yes, absolutely. And as I come to you, Dr. IP, now, do we have a new CEO? Am I correct on that? So is there hope at this point? You're muted. You're muted.
I do not know. What I know is that there is no board. I don't know if there's a new CEO, but I know there is no board at present. It's a little bit, from where I stand, it's a little bit more expansive than the role of the board. You see, we never had a board before, and things like hospital boards have come into being in the practice of providing quality health care for the same reason I've been emphasizing, because of the fact that technology is what drives it, and technology is financing. And apparently it was felt that across the world, not just in Dominica, that's been going on in the States and Europe for years, that governments were not efficient enough in that kind of management. And it was better to get a board that was independent, with the right people and with the right approaches and practices and policies, and that would hopefully improve the quality of care. But the board would have to meet certain requirements. They would have to be independent. They would have to be given the necessary funding to work effectively. And they would have to have, to me, an understanding of what is their role and function. And it would seem to me that the little I know about the functioning of the board in Dominica to date is like, as Nurse Felix is suggesting, that it's more about maybe regulating health professionals than addressing the other major issues of efficient use of resources, appropriate policies and practices, or if you want to put it, cutting edge care, which is not just only about regulating healthcare professionals. And so I think that is maybe the difficulty, because let's face it, and I'm not gonna be to say if the board, if the idea of the board was to bring some independence to the overseeing of the delivery of quality healthcare services, then that board should be relatively independent. If you even look at how the board is appointed, already it's lost half of its independence. So I think these are the fundamental issues. And if we don't get to the root of the problem, I don't think anything will work. So if the board is an issue, for example, one of my recommendations right now is that there need to be an audit, monitoring of evaluation of what has happened to the health care or the medical care services at the hospital since you put a board compared to when you didn't have a board, and what needs to be done. Because if there's this crisis, what is the real nature of the crisis? And who is going to demand that from the board or from the authorities? So I think it's again how we tend to do things in Dominica, that we don't go to the root of the problem, and we don't, I think, fully understand the role of the board, or maybe even the board itself doesn't fully understand its role if it's taking directives still from the ministry, and if it's not even there, how can it function? So I think these are some of the fundamental issues that, unless you address them without fear of favor and without fear of retribution, you're going to have a problem. Because
Absolutely.
Dominica is the last country in the Caribbean to institute this board at the hospital. We should not be having these problems because all these problems were sort of faced by all the other islands. So it is ridiculous to me. So I don't want to go there, but so fundamentally, I think that is the issue. What is the role and function of the board, and is it performing that role and function satisfactorily, and what are the reasons why it isn't? And we might very well find out one of the main reasons is the direction it has taken and the failure to understand that the ensuring that you get the money again to do the work you expected to do is the most crucial thing, because how are you going to motivate the health practitioner who is under stress if on top of the stress the salary is rock bottom, and if when they want to get a piece of equipment they can't get it, and then they have a patient who is delayed in the hospital for 3 days because they can't get a certain blood test, they now have to go and get the family to. So I'm saying, whether we like it or not, fundamentally, that's the root of the problem. Financing of the system, the efficient uses of the resources, and putting the people there who have the capacity to do the work and make the appropriate policies.
Absolutely. Thank you so much. And I'm coming to you, Dr. Amma, but Nurse Amma, but I think you need to finish your PhD because I keep calling you nurse. I calling everybody doctor this evening because you are highly qualified health professionals. But I'm happy that Nurse Felix mentioned Dr. Joffrey, because I thought I recognized his name. So correct me if I'm wrong, but he was on Fidina's program as Dr. Geoffrey Laffour. So Dr. Laffour, if you're still listening, I think there is space in this conversation for you, because I think what we would also be helpful is if we look at a comparison of healthcare, hospital healthcare in the other Caribbean islands versus what we're seeing in Dominica. So that would give us some perspective in terms of where we are in Dominica and the changes that are needed. So Dr. Laffour, expect a WhatsApp from me. I did actually get your phone number from Fidina a few months ago. So if you're willing, we would love to engage you in a conversation on this topic. But Nurse Amma, let me come back to you. And then guys, we're gonna come back to you for your final thoughts because the time is speeding ahead. And I want to ensure that we engage our Facebook Live contributors one more time, because I'm seeing some really, really good comments coming from Facebook. So Nurse Amma, let me have you finish your thoughts, and then we're going to circle back around for some final thoughts.
Okay, so I am always I tend to be a little bit more radical in my approach. I'm very, very liberal and very radical. And I don't think the root cause of the problem, as a nurse, we like to go to the pathophysiology of the disease process. Right now, our disease that's presenting, right now, we have a poor healthcare system. But if you go to what brings it to a poor level of functioning, it is really the people. The people themselves are responsible for where they are today. They're responsible with their vote. They're responsible with how they take care of themselves, and they're responsible with what they continue to do. We cannot have any change. We can sit here and talk forever. There will be no change until the people decide that they have had enough. How do you feel when you bring your family to the hospital and there are no supplies, that there's no EKG monitor, or there's an EKG, but there's nobody trained to use it? Or maybe there are people trained to use it, but they're inundated. How do you feel seeing your loved ones die because we don't have pads to put on you to code you? How do you feel about it? How do you feel that there are only 6 ICU beds and you're the 7th person coming in and your family is going to perish? How do you feel about that? So I want to challenge our people to spring into action. Do what's necessary first with your vote, with your voice, That's where you have the most power. You can call Q95 from now till December, like they say in Margot. You can call them all the days of your life. Nothing will change until you decide as an individual to make that change with the only power you have, your vote. So, in saying that, I also like actions. And where we are right now, people, we are in a state of crisis. And so we will deal with what we have. Follow me on Facebook, follow Bushman, Indigenous Bushman. He gives a lot of herbal education that you can use for yourself. Follow Dr. Margaret Wallace. She gives
Yes.
you the mental health part of it. We saw a lady in crisis recently, and we won't even go into that. But she did a live on that. So follow her so you can learn how to take care of your mind, your body, your soul. When you go into the hospital, which is what I'm supposed to respond to, but that can be my closing thought, Simone. I don't
Yes.
need to say anything after that. When
Yes.
you go into the hospital, there are certain things that you're going to need to take with you. And some of them are basic supplies that you should keep at your home. And I made a list, and it's quite disheartening that I even have to tell you some of these things on the list because they should be at the hospital. And so you need to make sure you have gauze, you have antibiotic ointment. You should all have this stocked at home. I will put it on my Facebook page. You can go on there for the list.
Yeah,
You
and you can
also
send
have,
it to me and I'll post it on
yeah,
Push Past 10 as well.
you need to have some kind of antihistamine for if your child is having an allergic reaction from bites, stings, or other food allergies that you previously did not know about. You need to have some kind of medication like Tylenol or Advil or whatever is your choice. You need to have some kind of antiseptic solution with you. You need to have, I heard now people are having to buy their own IVs. So if you can afford, check Amazon, get an IV starter kit, and be prepared. You need to make sure you have some kind of diarrhea medicine. So if you have all of this, you can kind of even reach out to a doctor or somebody that you know to see how you can take care of yourself. I'll tell you, one of the biggest things that the hospital does not have is the correct tubes for your blood work. So you need to have a blue top tube, you need to have a pink top tube, you need to have a purple top tube, and a light green top tube waiting at your home. This is ridiculous. I'm even saying this. For you to be able to get the correct blood work when you go, because they are sorely lacking in those supplies. I wish I could expound further, but we're running out of time. I'll follow up with a live on my page. You can add me on your Facebook and we'll continue from there.
Yes, remind us of your page again, please.
It's Amma Thomas. You can.
Okay. Yes, absolutely. And guys, don't forget if you missed any portion of the conversation this evening, because I think Ms. has given us a great list of supplies we all need to have because we know of the unfortunate situation at the hospital. Don't forget, from tomorrow, this program will be on Q95DA.com. So Q95DA.com, because I know a lot of our listeners are not on Facebook. So don't forget, you can catch every minute of this program from tomorrow on Q95DA.com. Of course, it will be on Q95 FM radio on Facebook and YouTube, and as well Push Past 10 on Facebook. So thank you, Ms. Amma. Thank you so much for that, and thank you for your contribution. You're someone we always know is ready and willing to make a contribution. So continue with the wonderful work that you're doing for our people. Ms. Felix, Dr. IP, your final thoughts as we get ready to wind down on Facebook. I promise I will take some comments in a little while.
Yes, I would like to encourage the public, to learn their rights and responsibilities, as patients, because the more knowledgeable you are about your responsibilities and your rights when you go to a health facility for healthcare, the better the better you are able to intervene and advocate for yourself, because you can say, you know, to if you, for example, on the note we started with, the language barrier, you're speaking to a health provider who is not understanding you. You're supposed to, you know, politely demand someone who can understand you and who you can understand to properly relay what is your health issue at the time. So that is very important. Additionally, you know, Halima spoke a lot about what nothing is going to happen now. Same thing, just the talk. And to some extent, I want to agree with her. So as a result of that, I want to encourage the healthcare professionals, all the healthcare workers, but in particular our physicians, like today took a stand. Don't stop. Push and push until you get results. You understand? Because we have a responsibility as healthcare providers to decide the direction we want healthcare to take. And if we sit and just accept everything that's going on, then we will not get anywhere. Or just live in Dominica and migrating elsewhere, it doesn't solve the problem in Dominica. My own nurses association has been pretty quiet. I'm sending out a challenge to my nurses association to speak up and act up. And I also heard, and it's my experience too, when I was on the Public Service Union executive, when healthcare workers are called out, they don't come out enough. They don't come out enough, and we have the power. You don't even need all the public servants in the officers in the country to make a big impact on deciding what you want in healthcare, and demanding that this board be accountable. Yes, they have been there 2 years until it is time for a new board. We've had a second CEO, and where are the fruits to show? Where are the fruits as far as it concerns patient outcome? Because yes, we are boasting of a state-of-the-art facility, and in all honesty, there are many new services and equipment that have been introduced, but where is the evidence of the outcome from the people? From the people, from us? What is it we so that the people who are talking the most, we want to get to that point where we're hearing them boasting of the healthcare they've received. Yes, there are many people who are boasting, but if you have those who are talking the most now on the bad end, we want to convert these to be able to say as well, yes, things have improved. Things have improved at our hospital, and that's my contribution as it pertains to where we are at our hospital, and quality control and risk management. We cannot improve. We cannot go to a higher level, next level healthcare, if we are not evaluating. And if we are evaluating and we are not implementing the recommendations, we're not going anywhere. Thank you for having me.
Now, Nurse Felix, I know you have a private practice. Would you want to share your contact information if anyone wants to get in touch with you?
Oh, sure. So, well, I don't have a physical space anymore, but I do mobile healthcare. I do I speak do counseling on online. I also have and my number is 617-0833. I have a Facebook page, Rosie Felix. I also have a very popular, but not only popular, high performance antioxidant fountain of life. Many people have heard about it. It's all natural, it's all plant. And talking about healthcare, when I was growing up, I like to give this story. When I was growing up, whenever someone was sick, a child, adult, whether it was their head, their toe, the adult said, Zafalani, l'inflammation. So everything was inflammation. Well, when I went to nursing school, I realized, yes, everything begins with inflammation. So too much salt, too much sugar, too much, everything begins with inflammation. So while we must continue taking in the right foods, exercising, we also need to fight the inflammation and free radicals. So call me up, and especially if the emerging infections like we see in the pandemic. So I have this product, lignans. So you can call me for your supply. My number is 617-0833. You can find me on Facebook as well, Rosie Felix.
Thank you so much, Felix. Thank you for your contribution and your passion about healthcare in Dominica. Dr. IP, over to you.
Thanks. First, I'm just gonna sort of sum up and say that I just like to endorse the position of Nurse Amma and Nurse Felix on the personal responsibility of everybody for their health, and that shouldn't be left up to anybody else but yourself, not your parents, not your wife, not your husband, not your doctor, your nurse, and definitely not your politician. And I think that is something that everybody needs to accept, that they have to take responsibility for their health. And that means developing an approach of prevention. But given the present state of affairs, I think they also have to consider in each individual some sort of financial arrangement for critical days or for emergencies, whether it means taking insurance, whether it means putting some money aside, because the state of affairs at the PMH as far as the Dominica China Friendship Hospital is going to be continuing for a while. Definitely. It's not going to disappear overnight. So I think people have to keep that in mind. Things are not going to change around soon. So those are the things I would recommend at an individual level. I also agree that the patient needs to hold the providers and the policymakers more accountable and force them to do what they're supposed to do if they don't want to do it. I think if you're not prepared to do that, you have to accept some of the reaping of what you sowed. Mm-hmm. At the level of the health professionals, given the immediate situation, I would like to extend my solidarity to the young medical officers who I understand have plucked up enough courage to take a stand. I know what it is like. I've been there. And I wish them well, and I hope other healthcare professionals within the institution will support them and hopefully force the authorities to do what they need to do, to support, to encourage, to give them better wages, better working conditions, and realize the importance of making sure you have a content healthcare professionals so that you can have quality of care to patients. I think the board of the hospital, there needs to be an immediate audit to know the exact state of crisis. I think all of us are saying the hospital is in a bad state, but I'm not sure that the information, the data has been collected to what is the nature, how bad it is. And it's going to be difficult to address the problems if you don't know what the real problems are and their degree of severity. So I think that's something that's immediate. The board also, to me, needs to be a little bit more collaborative with the healthcare professionals and look out for them a bit more. My sources, I get the impression there isn't that degree of collaboration that will speak to improving quality of care to patients, definitely central government needs to increase its subvention to the hospital. And patients, there needs to be an increased accountability of both the healthcare professionals and the administrative professionals within the system if we're going to see any changes. My health is my wealth, and I would like to tell everybody that I think that you are what you eat, and is what you put in your mouth that determines what you become. Mm-hmm. So pay a little bit more attention to what you eat.
Thank you. Thank you, Dr. IP. You have any contact information you'd like to share with us?
Everybody can find me, man.
Okay.
That's all right.
All right. All right, you're welcome. So guys, I want to be respectful of your time. So we are officially at the end of the program. So again, I want to thank you for joining us on this very important conversation where we looked at the changes that are required if we are to consider the Dominica China Friendship Hospital a state-of-the-art hospital. And we have several recommendations. We are going to put that document together of the 20 immediate interventions that are needed to get a handle on the amount of people who are complaining about the hospital, the amount of people who are dying at the hospital. So again, I want to thank you for your time. You can feel free to exit the room if you would like to at this point. But Lambi, if it's okay with you, I'd like to take just another 5 minutes just to read up some of our Facebook comments, because we've had some wonderful contributions. And I want to make sure that we acknowledge the over 100 people who joined us on the Facebook Live and the thousands who will view this program once it's done. So guys, you can hang around if you want to, but again, if you want to, you can also sign up. And again, thank you. So we have Marshall Lawrence, and he says, why is there no alternate healthcare service in Dominica? It is unlawful to establish anything else apart from what is present. I mean, some of our professionals getting together to make it happen. Oh, Dr. IP wants to chime in. Thank you for staying with us.
But that's why I said that people have to start to put their money aside, because there's alternate healthcare, but it's all in the private sector. Mm-hmm. And like you have several labs and several places you can get x-rays, and so you have a lot more private nursing and private medical practices. And I must say also that with two other colleagues, I have been able to set up a place where you can have private surgery. There's also the Paddy-based center. We can do now day surgery that you can go home the same day. And I'd like to take this opportunity to tell all the patients who've been waiting for a long time to have their thyroid surgery that I have started back doing thyroid surgeries and privately.
Thank you. Thank you. Akima Seraphin and adherence to this policy. So she's talking about adherence to the policies. I think Yiwa Burringe, Renurses Living for Better. I suggest our government do a survey as to what the nurses are going towards. All the agencies advertise their packages very attractive. They could maybe try to put a similar package together for us and we would stay. But for now, many of us choose our family's welfare first. The hand-to-mouth tradition is not working anymore. And guess what? A nurse is a nurse no matter where she goes. So clearly, this is someone who is a nurse. So Nurse Barrange, thank you so much for your contribution to the conversation. Jared Dorset, the state of the art in healthcare refers to the latest and most advanced methods, technologies, and practices in the field of medicine and healthcare. It represents the pinnacle of what is currently possible and is constantly evolving as new research, innovation, breakthrough occurs. David Joseph, let's be honest, it's not only patients who are afraid of going to the hospital. Some doctors are reluctant to send their patients to the hospital for fear of that they will not receive adequate treatment. Prior to her death, my mom's doctor reluctantly, sent her to the hospital. Unfortunately, a week later, she was gone. Wow, David, we are so sorry to hear that. Let's take someone we haven't heard from. And Ms. Barronge, thank you so much for all your contributions to the conversation. Let's see, Hermelina Watson, when a person is depressed, all these things doesn't appeal to them. A lot of people partying there to handle the stress. Besides, most of the CO are free rum and food. Let's take just a couple more. Alvin, I see you. He says, for example, the Dominica State College is currently functioning without a board of governors for the college. And that has been like that for some time. So everyone, thank you so kindly for your wonderful contributions. Yvette James, the question is legislation being followed? Lavette Lodin, the boards are politically engineered, hence the issue right here. Verna Charles, wake up, Dominicans. Someone else we haven't heard from. Usila James says, amen. Thank you for being here. Matilda Jolly, well said, Nurse Armour. Okay, let's see. Just a couple more. Madam Wabduet Canada, great to see you. Dr. Margaret Wallace, nice to see you. Uh, keep at home kids. And what is that? And antihistamine, I got it right, painkiller, antiseptic, gauze, diarrhea medicine, tubes to get correct blood work. Check Amma Thomas RN page on Facebook to get the full supply list. Thank you so much for that. Glenda Lavidou Burton, she says the hospital is a shame. Owen Prosper, everything that is happening in Dominica is our fault. We keep voting criminals for them to get richer. So everyone, I truly want to thank you for all the wonderful comments. I wish I had more time to read them, but of course, everyone who will come back and watch the Facebook Live will be able to see your comments. And of course, again, if you missed any of the program, it will be on q95da.com tomorrow. So again, I want to thank Lambi. Thank you for being on the console. Thank you to the panel, Nurse Amma Thomas, Abdullah, Nurse Rosie Felix, and Dr. Irving IP Pascal out there in Dominica. So we will continue to be your number one choice for discussing programs, showcasing programs, events, organizations that advance in Dominica, but also this is the place where we come and not only air our concerns, but we create action plans for the way forward. So you've been tuned in to Roots Connections on Q right here on Q95, the big station. Thank you to Q95, Mr. G, and everyone else who supports our ability to be on this platform to share with you. I am Simone Mathieu. Don't forget to follow Q95 FM Radio on Facebook and Push Past 10 on Facebook. And also, for all the ways that we continue to work to advance Dominica, you can check out pushpast10.com, pushpast10.com, and now with an audience of over 70,000 visitors a month. We are growing nice and steady. It is an opportunity if you are looking to grow your social media presence. So many of our companies need that extra boost to be able to reach wider audiences in terms of social media. And there's nothing to be scared about social media. If you can WhatsApp, you can do social media, and I'll be more than happy to guide you with your social media presence. So again, pushpast10@gmail.com, pushpast10@gmail.com. Let's just take one more comment. They keep coming. Jared Vital. Let's go back to Gerald because it just scrolled up. The idea and initiative of the private medical and business sectors providing healthcare services is an excellent understanding, but the question is, will it be obtained and afforded by those who need it most? So guys, it looks like we need a part 2, right? Can we agree? I think we can. So again, thank you for being here, and you have yourself a wonderful evening. Thank you to the audience, Lambi, and everyone else who made a contribution to the program. You have yourself a wonderful evening until our next program. And next program, we're going to look a little bit into the cannabis industry, so you don't want to miss that. So again, always great being here with you for Roots Connections on Q. Until the next time, you have yourself a wonderful evening's rest. Take care. Thank you, guys. Say bye. Unmute.
Good evening, everyone.
Thank you.
Thank you. Thank you for the opportunity. Thank you, everybody.
Oh, oh, children, home. I wanna go home. Oh, yes, children, home. Got to
I'm
go.
locked in.
Yeah, we've been